Welcome to 10 Daily Medical Questions. In today's tutorial, we'll explore Peripheral Arterial Vascular Disease, covering its pathophysiology, clinical manifestations, diagnostic approach, and management strategies. Introduction to Peripheral Arterial Vascular Disease, PAVD. PAVD encompasses a spectrum of conditions affecting blood vessels outside the heart, leading to ischemia and significant morbidity. Key conditions include arterial embolism and thrombosis, arteriovenous fistula, arterioembolic disease, claudication, cholesterol emboli, hypertensive vascular disease, peripheral arterial disease (PAD), and Thromboangiitis Obliterans. Pathophysiology. PAVD is primarily caused by atherosclerosis, a chronic inflammatory process leading to plaque formation, luminal narrowing, and impaired blood flow. Other etiologies include embolism, vasculitis, and thrombotic occlusions. Risk factors such as smoking, diabetes mellitus, hypertension, and dyslipidemia plays a crucial role in disease progression. Clinical manifestations. Symptoms vary depending on the severity of vascular involvement. Key presentations include claudication, cramping pain induced by exertion and relieved by rest, critical limb ischemia, wrist pain, ulcers and gangrene, acute limb ischemia, sudden onsets of the 6 Ps, pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia. Hypertensive vascular disease, chronic hypertension leading to arterial remodeling and reduced perfusion. Diagnostic. A thorough evaluation includes clinical examination, assessment of pulse, bruits, skin changes, and ankle brachial index. Imaging studies, Doppler sonography, first-line modality for assessing blood flow, CT angiography and MR angiography shows a detailed vascular mapping. Digital subtraction angiography (DSA) is the gold standard for definitive vascular imaging. Laboratory tests like lipid profile, inflammatory markers, and coagulation studies should be performed. High-yield exam questions and key clinical pearls. For medical students and professionals preparing for exams, here are some commonly tested points. What is the most specific diagnostic test for PAD? Answer: ankle brachial index, confirmed by imaging. What is the indications for urgent vascular surgery? Answer: acute limb ischemia, critical limb ischemia, failed medical therapy. What pharmacological treatments improve walking distance in claudication? Answer: cilostazol and supervised exercise therapy. Key clinical pearls. Always assess bilateral pulses to identify systemic vascular involvement. Treatment strategies. Management depends on the disease severity and includes lifestyle modifications like smoking cessation, regular exercise and dietary changes, pharmacologic therapy, antiplatelets, aspirin, clopidogrel for reducing thrombotic events, statins for lipid control and plaque stabilization, antihypertensives and glycemic control to mitigate risk factors. Interventional and surgical management. Endovascular procedures like angioplasty and stenting, bypass surgery for severe occlusive disease, thrombectomy and embolectomy for acute arterial occlusion. EMA guidelines and best practices. According to the European Medicines Agency guidelines, the recommended first-line treatment for PAD includes statin therapy, antiplatelet agents, and supervised exercise programs. Endovascular interventions are reserved for severe cases where conservative management fails. Ongoing clinical trials continue to shape treatment protocols. Prognosis and complications. Early diagnosis and treatment significantly improve outcomes. However, complications such as limb loss, infections, and cardiovascular events remain concerns. Long-term follow-up and patient education are key components of effective management. In summary, peripheral arterial vascular disease is a critical condition requiring a multidisciplinary approach. If you found this video helpful, don't forget to like, share and subscribe and hit the notification bell for more medical insights. Stay tuned for our next video, 10 medical questions on peripheral arterial vascular disease.